My name is Dr. Gita Sinha. I'm from the Department of Anatomy and Neurobiology. This is the first presentation of the Head and Neck series. In this presentation, I will be talking about the osteology of the skull. First, I will be demonstrating the different bones of the skull, and in the second part, I will be talking about the different opening at the base of the skull through which all the cranial nerves pass through. To demonstrate the osteology of the face and skull, I am going to use these three models. This model is a painted skull. On this model, I am going to show you the bones of the face and skull. In this model, the skull cap has been taken out, and we can see at the base of the skull. We are also going to see on this skull different openings through which the cranial nerve exit. This model has got all the bones separated out, and it will show all the sutures and the distinct features of all the bones. Let me start with the face first, and I will demonstrate all the bones of the face. So let's start with this yellow colored bone, which is occupying the frontal area of the face and the anterior part of the skull. This is your frontal bone, which is a single bone, forms, and if you can look inside the orbit, it forms the roof of the orbit. There is a small opening onto the superior border of the orbit that is called a supraorbital notch. The supraorbital nerve travels through this opening. Now we look at this brown colored bone, and I'm going through the outline of this bone. This is your maxilla. These are two paired bones, and they meet in the middle. It forms the floor of the orbit, as well as it forms the hard palate. This opening here is known as infraorbital foramen, and the infraorbital nerve exits through this opening. Now we look at this triangular blue colored bone, and I'm sort of showing you the outline. This bone is the zygomatic bone. It's a paired bone, right and left. This bone, with the process coming from the temporal bone, forms the zygomatic arch. This can be felt on the face, also referred as the cheekbone. Now I'm going to concentrate onto this vault of the skull, which is formed by this red colored bone, and these are again paired bones. This is known as parietal bone. The parietal bone shows two eminences on each side, and these are called parietal eminences, can be felt onto the top of the skull, on the sides of the skull. Let's look the back of the skull, And we are looking at this blue colored bone. This is a single bone forming part of the base of the skull here. This is your occipital bone. There is an eminence which is known as occipital eminence, this or occipital protuberance. There is a big opening into the occipital bone which is known as foramen magnum. Now I'm going to come on the side of the skull and look at this white colored bone. And this is the temporal bone, and the temporal bone is also paired bone. So there is on each side of the skull we have got the temporal bones. It has two parts. This part which we are seeing right now is known as squamous part. On the side here, we can see a green bone, and that is the part of the sphenoid bone. This is the greater wingosphenoid, and we are going to show this bone at the base of the skull or in the fragmented skull. On this model, I am going to show the outlines of the different bones and the position of the sphenoid bone. So now start with the frontal bone. This is your frontal bone. This bone, which is sort of hanging from the wire, is the ethmoid bone. The ethmoid bone forms the roof of the nose, and it sits just down at this region here. This is the right and left zygomatic bone, these triangle outline bones. Here we can see this is your right side of maxilla and the left side of maxilla. They come together to join in the middle. Down here we have got the mandible. This is the sphenoid bone. This bone forms the center of the base of the skull. It's almost an anchoring point for all the other bones for the base of the skull. Let's look at the distant. This is a single bone. Let's look into the different features of this bone. Now I'm going to show you the position of the sphenoid bone. The sphenoid bone is a single bone which sits at the base of the skull into the center. We are looking at the body of the sphenoid bone, and these are the wings, greater wings of the sphenoid bone. It's the shape of a butterfly, and it has got two wings on each side, a lesser wing and a greater wing, and the body. Let me put this bone in its position here. So now you can see the sphenoid bone sitting into the base of the skull. Now I'm going to show you the different parts of a sphenoid bone. This is the anterior end of the sphenoid. This is the posterior end of the sphenoid bone. Now we are looking at these little projection on each side. These are lesser wings of a sphenoid. In the middle, we see the body of the sphenoid. This is the body of the sphenoid. On each side, these big wings are known as greater wings. You can see the whole bone looks like a butterfly with two wings on each side and the body in the middle. These two projections are known as anterior clinoid process. This area here is known as dorsum celli, like a Turkish saddle. This fossa is known as hypophyseal fossa or pituitary fossa. The pituitary gland lies in this depression. Now we look at the two plates which project downwards. These two plates are known as pterygoid plates. Now we are looking at, this is the lateral pterygoid plate, and on this side I can see the medial pterygoid plate. Again, there is a medial pterygoid plate and the lateral pterygoid plate. That ends the demonstration of the sphenoid bone. So let me demonstrate the sutures which join these bones. This suture, which is joining, extending from this end and goes all the way up to here, joining the frontal bone with the two parietal bones, is known as coronal suture. This suture, which extends anteriorly from this point to this point and joins the two parietal bones together, is known as sagittal suture. This suture, which extends all the way from this end to this end, is known as lambdoid suture, and that joins the occipital bone with the two parietal bones. This area here, where you can see the four bones are meeting together, this is a H-shaped suture, and that is joining the frontal, the parietal, the temporal squamous part, and the greater wing of sphenoid. This area here is known as pterion. This area has got clinical importance because the middle meningeal artery, its branches lie deeper inside the bone. A blow in this area can cause a subdural hematoma. Let's look at the junction where the three bones are meeting together. This junction is known as bregma, where the frontal and two parietal bones are meeting. This area where the three bones are meeting, the two parietal and the occipital, is known as lambda. Let's look into a baby skull, because these create soft area. Let me demonstrate on this baby skull the two fontanelle, the anterior fontanelle and the posterior fontanelle. This is the soft spots. This is the anterior position of the anterior fontanelle, which is between the frontal bone and the two parietal bones. This is a diamond-shaped area which is covered by the membrane before the ossification takes place. Clinically, it can be used to aspirate the spinal fluid. Let's look at the position of the posterior fontanelle. This is the soft spot on the posterior aspect of the skull between the two parietal bone and the occipital bone. It's a triangular soft area. Now I am going to demonstrate the base of the skull, the cranial fossa. This region here is the frontal bone, the anterior part of the skull. This is the posterior part of the skull, the occipital bone. On the sides, this is the position of the squamous part of the temporal bone. The whole fossa is divided into three divisions: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. I am going to start with the anterior cranial fossa. This is bounded by the frontal bone, and on the posterior aspect, this is a lesser wing of sphenoid. These plates on each side are the orbital plates of the frontal bone. These form the roof of the orbits. In the center region, this is the area where the ethmoid bone comes in, and we see a projection of the bone in the middle. This is called as crista galli. A sleeve of dura, which is called as falx cerebri, attaches onto the crista galli. On each side of the crista galli, there are numerous openings are present, and these are known as cribriform plate of the ethmoidal bone. The olfactory bulb and the olfactory nerves are lying in this area. The olfactory nerves, which is the first cranial nerve, leaves the skull through these openings and enters into the nasal cavity. Now I am going to demonstrate the boundaries of the middle cranial fossa. The anterior boundary is formed by the lesser wing of sphenoid bone. The posterior boundary is formed by the petrous part of the temporal bone. This projection which you see in here is the petrous part of the temporal bone. So this area from here to there is the middle cranial fossa on each side. This area in the middle is your dorsum celli, which is formed by the body of the sphenoid bone, and this area here is where the pituitary gland lies, pituitary fossa. These two projections are known as anterior clinoid process. On medial aspect, we see these openings, and these openings are optic canals on each side, which enters into the orbit. The optic nerve with the ophthalmic artery travel through this opening. Now I am going to demonstrate the position of the superior orbital fissure. This slit-like opening on the anterior aspect of the middle cranial fossa is your superior orbital fissure. Through this opening, the third cranial nerve, the fourth cranial nerve, the sixth cranial nerve, and the ophthalmic division of the trigeminal leaves the skull and enters in the orbit. So the oculomotor, the abducen, the trochlear and the ophthalmic division of the trigeminal leaves the skull through this opening. Now I am showing you this round opening which lies posterior to the superior orbital fissure. This is foramen rotundum. The maxillary division of the trigeminal nerve passes through this opening. We come a little bit more posterior to that and find an oval opening. This is foramen ovale. The mandibular division of the trigeminal leaves the skull through this opening to enter in the infratemporal region. Just posterior to that, there is a small round opening. This opening is foramen spinosum. The middle meningeal artery from the infratemporal fossa enters the skull through this opening. The area which I am pointing right now on each side of the dorsum sali, this area is known as trigeminal impression. And this is the position where the trigeminal ganglion lies on each side. This is also the position of the cavernous sinus. So the right and the left cavernous sinus lies in this region of the middle cranial fossa. This area is filled by the temporal lobe of the brain. Now I am going to demonstrate the boundary and the openings of the posterior cranial fossa. This is the petrous part of the temporal bone. This forms the anterior boundary of the posterior cranial fossa. So this area here is the position of the posterior cranial fossa. This eminence which we look at the petrous part of temporal bone is known as arcuate eminence. Just inferior to that lies the middle ear cavity. On the posterior aspect of the petrous temporal bone, there is this opening which contains my wire. This is called as internal auditory meatus. Cranial nerve 7th and 8th, facial and vestibulocochlear. They leave the skull through the internal auditory meatus. Now I am pointing to this big opening. This is called as jugular foramen. Cranial nerve 9th, 10th and 11th with the internal jugular vein travel through this opening. The 9th is glossopharyngeal, 10th is vagus and 11th is accessory, spinal accessory. These nerves are going to exit the skull through this opening. Now I am showing the position of the hypoglossal canal. This is the opening through which the 12th cranial nerve, the hypoglossal nerve, exits the skull. This opening lies on the anterolateral aspect of the foramen magnum. Let me show you on the other view of the skull where you can see the exit of the nerve. This is a view of the base of the skull. I want to show you the position of the hypoglossal nerve coming out through the hypoglossal canal. The blue wire represents the hypoglossal nerve, and the area which is shown by the probe is the position of the hypoglossal canal. Now I'm going to demonstrate two impressions into the posterior cranial fossa. This groove here is for the sigmoid sinus. This is the venous dural sinus which lies in this area, and this is area for the transverse sinus. The transverse sinus continues as the sigmoid sinus, and then it becomes the internal jugular vein and exits through the jugular foramen. These impressions are where the cerebellum lies. This big opening is known as foramen magnum, through which the spinal cord exits the brain, and the basilar artery enters inside the skull. That finishes the demonstration of the posterior cranial fossa. This is a view of the base of the skull, and on each side here we see the position of the zygomatic arch. Posterior to it, this fossa is known as condylar fossa. This is where the condylar process of the mandible comes and lodges, and this is your TM joint, temporomandibular joints on each side. These two plates are your pterygoid plates, the lateral pterygoid plate on each side. This opening anterior to this is carotid canal. The internal carotid artery enters the skull through this opening. These two projections on each side are the styloid process. This projection here is the mastoid process of the temporal bone, and in between the styloid process and the mastoid process, this round opening is stylomastoid foramen. Through this opening, the seventh cranial nerve, that is facial nerve, exits from the middle ear cavity to enter on the face. So on the posterior aspect of the occipital bone, now I am pointing to the external occipital protuberance. So now this finishes the base of the skull. Now I am going to demonstrate the osteology of the mandible. This area here is known as symphysis mentae. This is the body of the mandible. The opening here, which is shown by my probe, is known as mental foramen. The mental branch of the inferior alveolar nerve exits from this area and supplies the skin on the chin and the lower lip. This area here is the ramus of the mandible. This beak-like anterior projection is known as coronoid process. The coronoid process gives attachment to temporalis muscle. This projection on the posterior aspect of the mandible is known as condylar process. This area here, projected area, is known as head, and the constricted area is the neck. The condylar process makes the TM joint. This area here is known as angle of the mandible. On the surface of this ramus, there is attachment of the masseter muscle. Let's go look into the internal anatomy of the mandible. This projected crest is known as mylohyoid line. The mylohyoid muscle, which forms the floor of the mouth and closes this area, attaches along this line. The opening which is shown by the tip of this probe is the mandibular foramen. Through this opening, the inferior alveolar nerve enters the mandible. We see a groove lying on the posterior aspect, and this is the groove for the nerve to mylohyoid. On the anterior aspect of the mandible, we see two pairs of the spines. There are superior genial tubercles and inferior genial tubercle. The superior genial tubercle gives attachment to the genioglossus muscle. The inferior genial tubercle gives attachment to the geniohyoid muscle. That ends the demonstration of the mandible. On this prosection, I am going to demonstrate the folds of the dura, the venous dural sinuses, and all the cranial nerves. Let me hold this fold of the dura. Now what we are seeing here is the right and the left side of the fold, which covers the two hemispheres of the brain. And if I turn this, I see a sickle-shaped region of the dura. This is known as falx cerebri. This attaches anteriorly, and we can see some of the part, to the crista galli. On the superior edge of this is the superior sagittal sinus, and the inferior edge of this is the inferior position of the inferior sagittal sinus. Let's take this superior sagittal sinus and inferior sagittal sinus. There I have got my probe in the superior sagittal sinus, and this sinus comes into this position here, which is known as confluence of sinus. Inferior sagittal sinus also will come and drain at this point. On each side, the blood will drain on the right and the left transverse sinus. So now my probe is into the transverse sinus. This will continue as sigmoid sinus, and then it will come to the jugular foramen, where it will become the internal jugular vein and will exit from the skull. Let's start with the cranial nerves. Let me go into an anterior cranial fossa, there is the frontal bone here, and here is the position of the crista galli in the middle of the anterior cranial fossa. Now I am pointing to the olfactory bulb. This is the position of the olfactory bulb. That's where your first cranial nerve, the olfactory nerve, is going to come out and pass through the cribriform plate to the nasal cavity. Now I am holding this is the second cranial nerve, optic nerve. You can see that there is the right side and the left side. They leave the skull through the optic canal with the ophthalmic artery. There is the ophthalmic artery on the right and left side. Now I'm holding this nerve on the medial side of the middle cranial fossa. This is the area here is the dorsum celli, and this is your third cranial nerve, the oculomotor nerve. This nerve will proceed further to leave the skull through the superior orbital fissure and supply the muscles of eye. Now I am holding this very thin thread-like structure on the fold of the dura. Here is, now I'm holding this nerve. This is your trochlear nerve. The trochlear nerve supplies only one muscle, that is the superior oblique muscle of the eyeball. Now we look into the fifth cranial nerve, and now I'm holding the fifth cranial nerve, that is your trigeminal nerve. The trigeminal nerve is a primary sensory nerve with a small component which is motor, which supplies the muscles of mastication. Let me show you the position of the trigeminal ganglion. I'm pointing to the position where the trigeminal ganglion is sitting at the lateral aspect of the dorsum celli this is also the position of the cavernous sinus here. Anterior to that, now my probe is into the foramen rotundum, where the maxillary division is going to pass through. The ophthalmic division passes through the superior orbital fissure. Now my probe is in the foramen ovale, and the mandibular branch of the trigeminal is passing through here. Just posterior to that, we see my probe is into the foramen spinosum, where the middle meningeal artery is coming, and these are the branches. You can see the branches of the middle meningeal artery, which is supplying the dura mater. Now let's look at the sixth cranial nerve, the abducens nerve, and here I'm sort of with my probe pointing the sixth cranial nerve. This nerve will pass through the superior orbital fissure and get inside the orbit and supply only one muscle of the eye, which is lateral rectus. Now I'm going to show you the seventh and eighth cranial nerve, that is facial and vestibulocochlear, and for that I'm pointing to the internal auditory meatus, and on this other side I'm pointing to the internal auditory meatus, and you can see these two nerves in here. This is your vestibulocochlear and facial. They will leave the skull at this point. Now I'm going to go into the jugular foramen. Now I'm pointing just below this internal auditory meatus, this opening here, and the opening on the other side here. This is your jugular foramen, and the four structures pass through here. Internal jugular vein, the 9th, 10th, and 11th cranial nerve. 9th is called glossopharyngeal nerve, and 10th is vagus, and 11th is the spinal accessory, and we can see the spinal accessory, the spinal part of this accessory nerve is coming down and getting exiting through the jugular foramen. That brings us to the last one, which is your hypoglossal nerve. And the hypoglossal nerve, I can see these sort of. The hypoglossal nerve here, we can see on this side there. The hypoglossal nerve is the 12th cranial nerve, which exits through the hypoglossal canal, and it will supply the muscles of the tongue. We can also see here this artery, which is the basilar artery, coming down into the foramen magnum, and we can see this what I'm looking at this point is the cut edge of the spinal cord, which is exiting through the foramen magnum. This finishes the presentation of the intracranial region, where I have talked about the folds of the dura, the venous dural sinuses, and also the 12 cranial nerves and the openings through which they are passing through. Let me start with question number 1. Name the structure that passes through the opening shown here by my probe. Question number 2. What structure passes through the opening which contains the probe? Name the opening. Question number 3. What structures passes through the opening I'm showing? Question number 4. Name 4 structures that pass through the opening containing the probe. Question number 5. Name the structure which passed through the opening which is shown here by the probe. Question number 6. Name 2 muscles which attach to this bony plate. Question number 7. Name the muscle which attaches to this bony prominence, which I am showing right now. Give its nerve supply. Question number 8. Name this opening. Give 2 structures that pass through this opening. Question number 9. Identify the structure. Question number 10. Identify the structure near my probe. Answer number 1. Olfactory nerve, cranial nerve 1. I am pointing to the cribriform plate. The olfactory nerve leaves the skull and enters the nasal cavity through the cribriform plate. Answer number 2. Maxillary nerve and foramen rotundum. We are into the middle cranial fossa. You can see the superior orbital fissure. Posterior to that, this round opening is foramen rotundum, and maxillary nerve passes through this second opening, that is where my probe is. Answer number 3. Middle meningeal artery. I am pointing to the foramen spinosum. You can see the position of foramen ovale. Posterolateral to that, this opening is foramen spinosum. Middle meningeal artery enters from the infratemporal fossa and you can see the grooves for its branches which are going to supply the meninges, the 3 meninges. Answer number 4. Internal jugular vein, glossopharyngeal nerve, vagus, and a spinal accessory. So the cranial nerve number 9, 10, and 11 with internal jugular vein. To identify this opening, you are looking into posterior cranial fossa. You can see foramen magnum. This is your petrous part of temporal bone, and this is your internal auditory meatus. Just below that, this opening here, where we can see the sigmoid groove, that is your internal jugular foramen. Answer number 5, that is facial nerve, and this is the probe is pointing to stylomastoid foramen. This is the mastoid process here. This is the styloid process, and in between this round opening is your stylomastoid foramen. So facial nerve exits from the middle ear cavity through the opening. Answer number 6, lateral pterygoid muscle and medial pterygoid muscle. This is your lateral pterygoid plate. The lateral surface gives attachment to the lateral pterygoid plate, and the medial surface gives attachment to the medial pterygoid plate. Answer number 7, the structure which attaches is temporalis muscle, and the nerve supply of that muscle is mandibular nerve. Answer number 8, this is mandibular foramen, mandibular inferior alveolar nerve, and inferior alveolar vessels pass through here. Answer number 9, transverse sinus, and you can see there is the confluence of sinus here. This structure which is going around in the posterior cranial fossa, that is your transverse sinus, which will become the sigmoid sinus, and then it will come out. You can see the blue shaded area. This is your sigmoid sinus, and that will become the internal jugular vein and exit through the jugular foramen. Answer number 10, this is vestibulocochlear and facial, cranial nerve 7 and 8. You can see this is the petrous part of temporal bone. We are into the posterior cranial fossa. This is the internal auditory meatus, and that's the 7th and 8th cranial nerve pass through there. Below that you can see the jugular foramen, through where the 4 other structures, 9th, 10th, and 11th cranial nerve and the internal jugular will go through. So that's the demarcation you use to identify the 7th and 8th by its position into the petrous part of temporal bone in the posterior cranial fossa.